At some point, you've probably heard mothers or fathers at an immunization session express concern about vaccinating their children. Some may have questioned the safety and efficacy of the vaccines, while others may have been concerned about possible side effects. Listening to caregivers express their concerns is an essential step in helping them overcome potential barriers to fully vaccinating their children. Do you feel comfortable and confident answering challenging questions from caregivers? Every time you speak with a mother or father, you have the opportunity to identify and address any fears or misconceptions they may have, improve their understanding of vaccines, and reinforce demand for immunization. In this video, we will discuss how to listen actively, establish common ground with caregivers, address caregiver concerns, assist decision-making, and leave caregivers feeling affirmed. The quality of your interaction with a caregiver is a key factor in ensuring the caregiver returns to complete the vaccination schedule for their child, and listening actively will help you identify a caregiver's specific concerns. Active listening involves encouraging the caregiver to talk, listening to them attentively, and then responding. The more you can have two-way conversation with mothers and fathers, rather than talking at them, the more you may understand them, and the more they can be sure they understand you. Actively listening to a caregiver could include showing empathy, such as saying, "I feel badly when my baby cries too." Or you could ask open-ended questions like, "What is on your mind?" or "How do you feel about that?" to encourage them to share their concerns. Asking probing questions can show caregivers that you are listening. You may ask, "Can you tell me more about that?" Finally, make statements to reflect back their feelings. If a caregiver seems concerned or anxious about vaccinating their child, but you're not sure yet what their specific concern is, you may say, "You seem concerned. Let's talk it through together." Now that you have listened to the caregiver and heard some of their concerns, begin your response with what you and the caregiver agree on. This establishes common ground. To the caregiver who is anxious about possible side effects, you may say, "It is true, some children may have mild side effects from vaccines, like a sore arm or fever." You may also say, "I understand that you want the best for your child, and I do too. I care very much about my patients." Next, address the caregiver's concerns. Do not ignore them, but do not repeat the misconceptions. It can also be helpful to use the child's name when responding to caregiver concerns. Make the discussion about being protected from disease rather than about vaccine safety. Address misinformation without being confrontational or dismissive. Remember, too much pressure or contradiction of a caregiver's beliefs can turn them off completely to your recommendations. You may say to a caregiver, "It sounds as if you are worried. Let's look at what we know and talk about what to do." As you talk with caregivers, help them identify what things are really important to them and eliminate the small issues. That will help simplify their decision. Reinforce vaccination as a social norm and use phrases like, "Almost all mothers and fathers in this community choose to vaccinate." Share your personal experience and give your strong recommendation to vaccinate. You may say, "It is hard to watch your child crying while getting a shot or having a sore arm, but it is worth it to know she's getting the protection she needs for a long, healthy life." Finally, finish your interaction with an affirmation of the caregiver. even if they have not chosen to vaccinate. You may say, "I want to congratulate you for doing such a good job taking care of your child. I look forward to seeing you again in 1 month." When you listen actively, establish common ground, address concerns, assist in decision-making, and affirm caregivers, you are leaving them with a quality interaction and improving their understanding of vaccines, ultimately encouraging them to return to complete their child's full vaccination schedule.